Good morning, everyone. My name is Anjum Damani, and I'm a third year internal medicine resident at Texas Health Resources. Today, I'll be talking about my research on hospitalizations and inpatient mortality in ANCA associated vasculitis, a nationwide analysis of the national inpatient sample. Before we get started, I would like to thank my co authors and my mentors, Dr. Patel and Dr. Basu, for their immense support throughout this project. So let's get started. When we talk about ANCA-associated vasculitis, we often focus on controlling the disease activity, getting patients into remission, and preventing relapses. But once these patients are hospitalized, what actually brings them to the hospital? And perhaps even more importantly, what are they dying from? Those were the questions that motivated our study. And to answer these questions, we used the nationwide inpatient sample, the largest all-payer inpatient database in the United States. We included adults hospitalized between 2019 and 2022 with the ICD-10 codes for granulomatosis with polyangiitis or microscopic polyangiitis. Our goal was straightforward. We wanted to identify why these patients are being admitted, what predicts poor inpatient outcomes, and where we may have opportunities to intervene. So let's get started. We found that there were around 114 million hospitalizations nationwide during those periods. We identified approximately 53,000 admissions involving ANCA-associated vasculitis. This tells us that even though ANCA-associated vasculitis is uncommon, that is only 4.6 admissions per 10,000 hospitalizations, its inpatient mortality remained pretty substantial at 5.6%. That is nearly 1 in every 18 hospitalized patients. We also found that these patients tended to be older, were predominantly white, and nearly 80% were treated at teaching hospitals, highlighting the complexity of the care required. Now let's move on to the table 2. That's when we found the reason for their hospital admission. We found that cardiovascular diseases, rheumatologic reasons like flare-up of the disease, and infectious accounted for most common reasons for their hospital admissions. We then asked a different question: which of these patients actually died? And that brings us to table 3. Infections accounted for more than 1/3 of all inpatient deaths, far exceeding active rheumatological diseases. So this tells us that while vasculitis was certainly what brought the patient into the hospital, it was infection that appeared to most determine that if they would survive the hospitalization or not. We further looked into the ICD-10 codes, and we found out that sepsis was the most common ICD-10 code, followed by the flare-up of the disease like granulomatosis with polyangiitis and acute kidney injury and then pneumonia. So this tells us that the consistency across multiple analysis suggests that this isn't simply a statistical finding. It reflects the real clinical burden. The third question was, what opportunities do we have? And I think that opportunities like vaccination, screening patients for latent infections like tuberculosis, hepatitis, prophylaxis for pneumocystitis in high-risk patients or patients on high-dose corticosteroids, close follow-up of these patients while they are on induction therapy, and also educating patients to seek care and to identify the early signs of infection. All of these can actually help reduce the mortality rate. And pretty much that's what our presentation highlights. To conclude, I would like to talk about the limitations of my study. And just like any other retrospective study, my database does not tell me about the readmission rates. My database does not tell me how severe their ANCA-associated vasculitis was and on what immunosuppressive medications they were on. There can be coding errors as well. I think we need further research to find out why these patients are more prone to infections and what can we do to reduce the mortality rate. Would be helpful in further understanding the disease and finding out reasons why infections remain the leading cause. That is all about my research. Thank you so much for listening, and feel free for any questions. Thank you.